It's actually the third most common cancer in Singapore men. It is found only in the prostate gland, and the basic function is to provide the prostatic fluid, which is actually the semen during ejaculation. Prostate cancer happens when some of the cells in the prostate turn to become malignant, which is a cancer cells. The cells do not stop growing, it keeps growing and growing. That's how the cancer comes about. Unfortunately, majority of our patients with prostate cancer do not have symptoms. They may not have any urine problems, may not have any blood in urine, they feel perfectly well. So unfortunately, this becomes detected much later unless patient go for a blood test. And the blood test is called prostate specific antigen. It's a simple blood test that can be taken from any polyclinic or GP clinic. In Singapore men, up to 2017 data from Singapore Cancer Registry, there's about 1,000 patients who have new cancer diagnosed every single year. Out of this group of patients, we do know that about half of them have a stage 1 or stage 2 cancer. It means that they are easily curable if they are found in the first and second stage. 30%, about 1/3 of patients are actually found stage 4 and it's too late. So we hope that we can discover prostate cancer much earlier so that they don't end up to become stage 4 when they are diagnosed. The risk of prostate cancer are a few. Anybody who's a father or uncle from the father's side may have passed a gene of prostate cancer to you because it's a genetic risk. The other risk factors are a higher intake of red meat and fatty food. We have done some laboratory study and found that patients who take more of a chemical called lycopene have a higher chance to protect and prevent prostate cancer, although it doesn't 100% remove the risk of cancer. Examples are tomato, watermelon as well. Screening is not truly recommended in Singapore because PSA itself is not 100% a marker of cancer. The PSA blood test can be high even in a normal prostate that's growing. It can also be high when there's a urinary tract infection. It doesn't mean someone with high PSA definitely have prostate cancer. However, I do recommend doing at least once when you are more than 50 years old because it actually gives you a number to your PSA and estimate the risk. If the PSA is higher than normal, it's best to check with a specialist to find out is there any necessity to continue checking for prostate cancer. Prostate cancer is an interesting cancer. Those patients who are found in a very early cancer stage sometimes may not need treatment, what we call active surveillance. The main aim for us is to find out prostate cancer that is dangerous, that may become aggressive, and those that may potentially harm a person's health. Early stage cancers can be cured much better than the late stage. There are some early stage prostate cancer that need treatment. Some of the treatment includes surgery, and second treatment is actually radiotherapy. There's a new treatment that only focuses on treating the cancer cells but does not damage the rest of the prostate that is still healthy, and that is called focal therapy for prostate cancer. So for prostate cancer, because it occurs in men, some of the men do not share their emotions readily, and some of them may not think that whoever is talking to them understand how they feel. It is not an easy subject to tell any stranger because it's hard for a man to tell somebody else how they feel about having a cancer or even the side effects of treatment. Which is why in the previous hospital I worked, we started a prostate cancer support group that's run by the patients themselves, and they invite their family members together so that they can share with each other the experience and how to handle the treatment, how to choose treatment, and also handle any issues that may be they have with a prostate cancer treatment. The other place that patients can look for information is actually the Singapore Cancer Society. They have a program for prostate cancer survivors, and they also have a lot of program for patients and their family. It's very important to continue standing by your men so that they can both manage their disease and also take care of their emotional needs.